people who come to our service, we want to respond in a holistic way, and we want to advocate that people get a more seamless service experience through our funding. Over time, we've organised the work we do into clusters because those clusters represent a service system. We've called it clusters so that they're more open-ended, they're collaborative, and they help each other achieve their goals.
We want our service to be a place where everyone can feel supported and heard and listened to, and be provided with team members that understand their experience. So everybody's experience can be different. So their experience of violence, it can be as diverse as the population. So we know that the rate of women and children, young girls who experience violence in their lifetime is significant. So we know that the diversity of the services that we need to offer needs to represent the diversity of the community.
I think that what the cafes do address people's barriers to social and economic participation and offer a safe space for people to perhaps integrate into the broader community.
Micah Projects started through St Mary's Catholic Church at South Brisbane. The community wanted to do something as a collective, so decided to set up a not-for-profit and call it Micah, which was based on the principles of act justly, love tenderly, walk humbly. It wasn't a faith-based response, it was more a human response. So people in the community, which was both local and people from all across Brisbane, really wanted to see us do two things. How do you get better services to people, and how do we advocate to get the change you need to end homelessness?
We drive our programs on the assertive outreach model. So we are not waiting to hear about it. We try to be proactive and actually go out and engage with the need where it is, as opposed to creating a space for the need to come to us. Our mission is to get out there. The whole team is designed around going outside and not being center-based. And I think this is a testimony of, this is an outcome of years of advocacy for this kind of a service to be deployed in the way that it is.
I've been homeless. I had no choice. So then I went to Micah and asked Micah for help, and they put me in a motel.
I was very interested in how we maintain a vision for social justice and provide services, not really ever lose sight of that what we're here for is to have a more socially and just and equitable community.
Show off. Go on, you buller. I got the news when I was in the motel that I had a house, and I am so happy.
Things rapidly change. We've probably seen that in the greatest way with the experience of COVID. The impact on individuals, the impact on organisations, the impact on our systems of care.
I've been coming here for 2 years. They vaccinated for COVID-19, they gave me the influenza shot, they helped me with liver problems. You know, what more can you ask?
And then we've got all bed at Tusk, so there's 4.
A lot of the market-driven responses to housing, people can't afford it, Incomes haven't gone up, like we're still advocating for an increase in New Start. You know, the whole sector knows that people need more income to be able to afford a house and to live a decent life. So those things haven't changed and modernised as the economy's changed. So people are left behind.
Supportive housing is about the provision of safe, permanent, affordable housing to people who require it, and coupling that with accessible, appropriate supports.
Here is the sky, here are my friends, and here am I.
We're really committed to working towards prevention, and Young Mothers for Young Women is a program that predates even Micah's incorporation. It was a group of young women who were advocating for services that they wanted and that they believed they, as peers, should be part of. But now it's developed into family support and antenatal education and services with the Mater Hospital and the Caboolture Hospital. We acknowledge and affirm the courage of all people who have experienced childhood abuse in institutional settings. We've worked strongly with the lived experience group, as everyone refers to people now, who experienced historical abuse. So we've been involved for the 27 years with them on advocacy. Now we are providing services to people and have done for 27 years. At Micah, we see every day in our work the impact of racism and the impact of government policy on the lives of First Nations people. And we are very committed to working with First Nations managed organisations and communities to provide a culturally appropriate response and also to address discrimination and racism. Because at the moment, our resources as a country aren't distributed equitably, and the poorer you are, the more you miss out. We chose to deinstitutionalise, so we've got to support people better who have a disability. We've got to stop putting people in prison for issues that could be dealt with in the community. Drug and alcohol issues need to be treated as a health issue, not just a criminal issue. You know, we've got to stop this cycle of intergenerational poverty where children are going into detention when they shouldn't be. That's what homelessness mirrors back to you, is those systems that just have left people on their own, and then this is the cost of it. For the future, Micah wants to continue to work on prevention, supporting people have a quality of life in their home. It doesn't matter what issue people come to us that they need assistance with, being in a home will be foundational to be able to respond to them. So we all need to work to that, no matter what our funding source is or what our vision of the future is.